The House will come to order. Reports from the Committee on Rules and Legislative Administration.
Winkler from the Committee on Rules and Legislative Administration, pursuant to Rules 1.21 and 3.33, designates the following bills to be placed on the calendar for the day for Thursday, May 9th, 2019, and establishes a pre-filing requirement for amendments offered to the following bills. House File numbers 28 and 1262, Senate File number 278, and House File numbers 70 and 2051.
Calendar for the day. The first bill on the calendar for the day is House File 1300. The clerk will report the bill.
House File number 1300, number 2 on the calendar for the day, an act relating to state government.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File number 1300.
Third reading. I recognize the author, the member from Anoka, Representative Koegel, to explain her bill.
Thank you, Madam Speaker and members. One lesson that I have learned in the past 5 months is that being a parent is hard and definitely not glamorous. It's one of the biggest changes in your life has just happened. You're in pain, you're getting no sleep, and are expected to be the happiest you've ever been. The difference between expectation and reality is about as different as the House and Senate budget targets. So one third of mothers report having symptoms of pregnancy and postpartum mood and anxiety disorders each year, and many cases also go unreported due to misunderstanding. So what this bill would do would designate May Maternal Mental Health Awareness Month to make sure that we can get all Minnesotans educated about the mood and anxiety disorders that come along with pregnancy and postpartum. So I urge your support of the bill. Thank you.
Discussion. Any discussion to the bill? Representative Erickson.
Thank you, Madam Speaker. And would Representative Koegel yield to a question, please?
She will yield. Representative Erickson.
Thank you, Madam Speaker. And Representative Koegel, I certainly can relate to this, having been a mom a long time ago, gave birth, but nevertheless, these issues persist. So how do you think we can achieve this awareness? Are you thinking PSCAs or, public service announcements, or what other strategies do you perceive will be used? Hospitals, clinics? Would you just share some of that with us so we have some affirmation of how this will transpire and be effective?
Representative Koegel.
Thank you, Madam Speaker. Representative Erickson, the state would declare that public education, and the governor would also promote it. I think the great thing about this is that a lot of the hospitals and providers are already doing this. I know that every appointment I go to, they ask those questions about how you're feeling. And so I think really just making sure that we can get that out to the public and just make sure that people don't feel alone when they're going through these, and to know that it's normal and okay.
Seeing no further discussion, the clerk will take the roll on the bill. The clerk will close the roll. There being 127 ayes and 0 nays, the bill is passed and its title agreed to. The next bill on the calendar for the day is Senate File 558. The clerk will report the bill.
Senate File number 558, number 3 on the calendar for the day, an act relating to state government, the second engrossment.
The member from Ramsey, Representative Pinto. Hold on just a second. There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File number 558.
Third reading. Representative Pinto.
Thank you, Madam Speaker. Members, the bill before you today deals with public procurement bid protests. This is where somebody challenges the award of a public contract. I want to emphasize this doesn't make any policy changes in this area. It simply clarifies which court can hear these protests. In the past, it's been to the district court, which can do some fact-finding, et cetera. There's been some confusion in the past couple of years and belief that perhaps the Court of Appeals is the court that would have to hear these. Members, this bill has been vetted by the State Bar Association, Associated General Contractors of Minnesota, state agencies, organizations representing our city and county governments to clarify that a district court is the right place to hear these. It's a good and well-vetted bill. Members appreciate your support.
Discussion to the bill. Seeing no discussion to the bill, the clerk will take the roll. The clerk will close the roll. There being 129 ayes and 0 nays, the bill is passed and its title agreed to. The next bill on the calendar for the day is House File 559. The clerk will report the bill.
House File number 559, number 4 on the calendar for the day, an act relating to health, the first engrossment.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File number 559.
Third reading. Representative Pinto.
Thank you, Madam Speaker. And so, members, this is an eye care protection bill to protect the health of people who are using internet vision testing websites and apps. And so what this does is ensures that when there is an online eye test, that there is still a relationship between the patient and the person prescribing the test and making sure that medical history, et cetera. Members, I actually have an eye condition since birth that severely limits my sight in my right eye. I've spent a lot of time with ophthalmologists, and the thought that people are receiving eye care and that sort of thing without the kind of protections here would greatly concern me. Again, this is a well-vetted bill which has been worked out through a number of folks. Representative Tice carried the bill in the past. I'm glad to have her support this year as well, and ask for your support, members. Thank you.
Discussion to the bill. The member from Olmsted, Representative Quam.
Thank you, Madam Speaker. Would the author yield to a question?
He will yield. Representative Quam.
Thank you, Madam Speaker. And I had gotten something in my eye, couldn't get into the doctor, went to my ophthalmologist's office, and they were able to get me in, check it out, write a prescription, and I noticed there was a 2% showing up. Would the online also have the 2% sick tax? And is there any issue with taxing over the internet commerce?
Representative Pinto.
Thank you, Madam Speaker. And Representative Quam, what this bill is focused on is whatever it would do regarding taxation, what this bill does is make sure that when you do get that online prescription, that it actually is something which is taking advantage and taking care of your eye health without having any concerns that it's not doing so. So regarding the tax issues, yeah, this does not go to that. And thanks for allowing me to describe the bill.
Representative Quam.
Thank you, Madam Speaker. And, I'm just curious because before in past years, I'm not sure if you were here when we were talking about taxing and business and, phone solicitation and internet and et cetera. And I am all for using technology in medicine and providing. I just would like to understand the ramifications, for the tax code and other things. Thank you.
Representative Drazkowski.
Thank you, Madam Speaker. Would the author yield?
He will yield. Representative Drazkowski.
Thank you, Madam Speaker. Representative Pinto, your bill puts an additional mandate on people who are in a situation where they need to seek, as I can see it, eye care products or eye care assistance devices or products. So we are putting a mandate on the people of Minnesota that says if you want to do this, you have to see the doctor in one way or another, and you outline in the bill the ways that you, as a patient or as an individual, have to establish a patient provider relationship, and actually, how much are we going to increase the cost for people who are going to simply want to get contact lenses or eye drops or whatever else might be covered by your bill? It seems very clear to me we're increasing the cost here. How much is it going to cost this person because of this additional layer of government you're putting in the bill?
He will yield. Representative Pinto.
Thank you, Madam Speaker, and thank you, Representative Drazkowski. Well, if you think about the fully loaded cost of receiving a bad eye examination that then can result in something that could have been diagnosed and is not, and the huge cost that can be imposed on somebody because of that. Overall, Representative Drazkowski, I would think this should in fact lower costs for folks. I think it's important for members, as long as we've received these questions, to recognize that when there is ophthalmic goods that are prescribed, there needs to be a provider-patient relationship which can be established in person, number one, through face-to-face interactive two-way real-time communication, number two, so you got kind of FaceTime. Or number three is there can be these store and forward technologies. So Representative Drazkowski referenced the people of Minnesota. It's just as likely that it's going to be a provider from outside our state who we want to make sure is giving good eye care to our patients inside the state. That's what the bill does. Thank you.
Representative Drazkowski.
Thank you, Madam Speaker. Would the author yield again for question?
He will yield. Representative Drazkowski.
Thank you, Madam Speaker. Representative Pinto, these additional onerous mandates on the people of Minnesota to seek to get the things that they need in order to put their eyes in comfort or help their eyes see better, or whatever we're including in this bill, contact lenses as an example. What happens if they want to do the right thing for them, and that is to simply get these things? They won't be able to get them through a prescription. I'm assuming they essentially won't be able to get access to them if your bill passes. Is that correct?
Representative Pinto.
Thank you, Madam Speaker. No, that is most certainly not correct. They could have the prescription in person. They can do so via FaceTime technology, just chatting in that way. Or number three, they can do so by taking a picture and sending it, store and forward. But then there are some limitations here just to make sure that when they do that, that they can actually get a prescription that is making sure to take good care of their eyes.
Representative Drazkowski.
Thank you, Madam Speaker. Well, Representative Pinto, I understand that part of the bill. So those are the ways that the patient-doctor relationship can express itself, at least according to your bill. So my question is there any other way that a person in Minnesota, if they want to get contact lenses, can get them? If your bill passes into law, do they have to do this in order to get contact lenses, or are they without contact lenses at that point?
Representative Pinto.
Thank you, Madam Speaker. Well, Representative Drazkowski, given the options of doing so in person, virtually live, or virtually not live, that pretty much covers the waterfront, and yes, those are the three paths.
Representative Drazkowski.
Thank you, Madam Speaker. Well, Representative Pinto, I understand the three options in your bill, the three mandate options that you're placing in the bill. Some people don't like the mandates of government that this place is currently putting on them. Your pursuit of a socialist utopia is going to be very, very cumbersome on the people of Minnesota as they try to continue to pursue their lives and live them. So that's what I'm after here, Representative Pinto. I understand what your bill does in those three optional mandates. Would the author yield again, Madam Speaker?
He will yield. Representative Pinto. Representative Drazkowski.
Thank you, Madam Speaker. So Representative Pinto, I guess that was my question, Madam Speaker. I guess I got it handled. I'll forego the yield request, Madam Speaker, but just some comments here, and that is, members, this is yet another mandate on the people of Minnesota being brought forward by the Democrats in pursuit of their socialist utopia. I hope the people of Minnesota can see clearly what the Democrats are doing to them here. Thank you, Madam Speaker. Please vote no, members.
Any further discussion to the bill? Seeing none, the clerk will take the roll. The clerk will close the roll. There being 112 ayes and 17 nays, the bill is passed and its title agreed to. The next bill on the calendar for the day is Senate File 1732. The clerk will report the bill.
Senate File number 1732, number 5 on the calendar for the day, an act relating to health, the first engrossment.
There are no amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File number 1732.
Third reading. Discussion to the bill. The author of the bill, the member from Hennepin, Representative Robbins.
Thank you, Madam Speaker. Thank you, members. This bill addresses a small issue, but not small to us in our district and Representative Acom's district. Current law right now, when you have an ambulatory surgery center, the Department of Health determines what the licensure is, and we have a surgery center in my district that would like to use some of the space in a surgery center in Representative Acom's district, and the Department of Health came to us with this language just to clarify that they would have statutory authority to grant this dual licensure. So it's supported, we're having something distributed, but it's supported by the Minnesota Ambulatory Surgery Center Association. And it's still, all the decision-making authority still rests with the Department of Health, but it just clarifies that two different entities could use the same bricks and mortar building. Thank you.
Discussion. Any discussion to the bill? Seeing none, the clerk will take the roll on the bill. The clerk will close the roll. There being 129 ayes and 0 nays, the bill is passed and its title agreed to. Motions and resolutions. There's a motion at the desk. The clerk will report the motion.
Winkler moves that the chief clerk be instructed to invite the Senate by message to a joint convention to be held on Thursday, May 9th, 2019 at 12 o'clock noon in the chamber of the House of Representatives to elect members to the Board of Regents of the University of Minnesota.
Representative Winkler.
Madam Speaker, our most talked about issue of the session is finally being resolved. There will be a joint convention to elect regents.
Representative Winkler moves to invite the Senate to a joint convention. All those in favor of the Winkler motion, please say aye. Aye. Those opposed, please say no. The motion prevails. Announcements. Representative New.
Thank you, Madam Speaker. Would Majority Leader Winkler yield to a question?
He will yield. Representative New.
Thank you. Madam Speaker, so we've got 13 days left in session. We blew past your deadline for budget targets. Right now, I know negotiations broke down last night with not budging on the $12 billion in tax increases. So I'm wondering at this point when we can expect budget targets.
Representative Winkler.
Madam Speaker, Representative New, just to clarify any confusion, yesterday the House and the governor both made multi-$100 million offers to come down, and the Senate offered zero in response. And so the answer to your question is that we will have targets sometime after the point at which the Senate decides it wants to compromise and get this deal done.
Representative New.
Thank you, Madam Speaker. Am I understanding, will Representative Winkler yield to another question?
He will yield. Representative New.
My understanding, Representative Winkler, and perhaps please correct me if I'm wrong, my understanding is that there's been no movement on the $12 billion in tax increases. Am I incorrect on that?
Using words other than the ones that I used. Representative Winkler.
Madam Speaker, Representative New, anybody who told you that was giving you a lot of baloney.
Representative New.
So, Madam Speaker, thank you. If Representative Winkler would yield to another question.
He will yield.
Thank you, Madam Speaker. So am I to understand then that yes, indeed, there has been movement made on the $12 billion in tax increases? And if so, could we just let the body know what those are?
Representative Winkler.
Madam Speaker, Representative New, this has been, I think, well covered. Yesterday, the governor offered to reduce his general fund expenditures by $200 million. The House DFL offered to reduce our total to the governor's level, which is a $664 million reduction in our general fund spending target. And the Senate offered to shift $25 million around within their own cuts budget.
Representative New.
Thank you, Madam Speaker. So I guess I'm understanding that no movement has been made by the Democrats in decreasing the $12 billion in tax increases. So I guess we will wait and see what happens. Thank you.
Representative Winkler.
Madam Speaker, I move that when the House adjourns today, it adjourns until 9 a.m. Thursday, May 9th, 2019.
Representative Winkler moves that when the House adjourns today, it adjourns until 9 a.m. Thursday, May 9th, 2019. All those in favor say aye. Those opposed say no. The motion prevails. Representative Winkler.
Madam Speaker, I move that the House do now adjourn.
Representative Winkler moves that the House do now adjourn. All those in favor say aye. Those opposed say no. The motion prevails. The House stands adjourned until 9 a.m. Thursday, May 9th, 2019.